Welcome to Chapter 3, Part 2, in terms of the video lecture. We had just finished talking about the definition of social work. Social work evolved, and in another chapter we'll talk more about this, from originally a volunteer movement all the way to a full-fledged profession, which it is today. We're going to talk a few minutes now about social practice approaches. And one of the things I want to say is as we go, and I think I mentioned this in the other video somewhere along the way, whenever someone's name comes up, especially in an introductory course, those people have usually contributed some very foundational, noteworthy things to the profession that they belong to. And when we talk about social work practices, there's one person, Mary Richmond, who is one of those pioneers, one of those founders. Social work was being done, but it hadn't been really written down anywhere how you go about it. And in 1917, Mary Richmond wrote the book called Social Diagnosis. And that was the first one that put down on paper form what social casework was. The very fundamental type of practice of working with an individual and working with a client. And in her book, in terms of, besides describing techniques, she also had forms to use. It was kind of the seminal work for the practice of social work. So she's one of those pioneers. You want to make sure that you remember her. Now, when we talk about social work practices, there's different practice approaches. One that's referred to in the textbook is called the generalist practice approach. You can imagine when social workers are dealing with all kinds of different people from all stations of life, from all backgrounds, and it's such a wide variety of the kind of experience that you have with people. The generalist practice approach is where a social worker has a broad liberal arts education and knows a lot in a lot of different fields. Mental health, economics, childhood development, just a whole host of things, and uses that broad generalized information, knowledge, and training to help treat a wide variety of people. And that's the generalist practice approach. But there's also a specialized practice approach. And that's where you have a social worker who has gone on, usually then it's at the graduate level, to get specialized, focused information, knowledge, practice, and training. Like being a school social worker, where you know the broad things, but then you focus in on learning particular things about doing social work in schools. And that's usually then something that happens at the graduate level. You can, in some ways, kind of compare this with medicine. The general practitioner doctor, someone you can go to no matter what you have. You have an ache here, a pain there, something's happening with your eye or with your foot. You go to your general practitioner, your primary care physician. Most of the time, they can take care of what it is. When they can't, they send you to a specialist. Well, you need to have a particular procedure that has a certain focused, expertise that is needed. So we're going to send you to a surgeon or to a cardiologist. So it's similar with social work. So you have generalist practice, which usually is your bachelor's level work, and then your specialized practice, which is the master's, and then also the PhD. Now, you'll be reading in the chapter here, there was a lot of debate back and forth when the National Association of Social Workers, became the main agency, the main professional group of social workers as to just who qualified to be a full-fledged professional social worker. And it went back and forth, but for a long time, the NSAW, you had to have a master's degree to be able to call yourself a full-fledged social worker, professional social worker. But over time, by about 1970, that institution, changed its mind. And I think it was really good that they did, because you have so many people who have bachelors of social work, up until that point. They were doing the work, full time, and I think that they deserved that kind of acknowledgement that they were, in fact, professional social workers. So in 1970, the NSAW welcomed in thousands of new members, as people from the bachelor level uh, applied for membership. And then about in the 1980s, I think it was about 1981, the NSAW was trying to distinguish some of the different levels of practice. And they had four, and in another chapter we'll get to them. But I'll just mention them briefly here now. There's the basic professional, which is the BSW, the specialized professional, the new, graduate out of a graduate program, the one who has an MSW, but they've just gotten it. The independent professional, that's someone with a master's degree, and they've now got, though, a couple years of experience, and they have a license. Of course, at the bachelor's level now, you also require to have a license as well. But for the independent professional, someone who would be able to operate on their own, not necessarily be in an agency, maybe in private practice, doing counseling or therapy, would have to have a minimum of 2 years experience. And then the advanced professional, that's someone who's gone on, maybe in research or administration, teaching, where they've gotten a PhD. Now, in this chapter, towards the end, I want to draw your attention to a couple of the tables, tables 3.1 and table 3.2. This textbook does make use of different charts and tables, and I do want to strongly encourage you to be sure to look them over and make them a part of your notes. It's another way of capturing the information in the chapter. Now, there won't be a question that'll be obscure, that'll be kind of from the middle of a big list. But you especially want to know what's up at the top, what's up at the very bottom. I'll give you an example. In table 3.1, which is characteristics of licensed social workers, where are they practicing, and what kind of field are they practicing, and in what kind of setting are they? That means the actual business or agency that they're at, and then what their primary job function is. So if you look at table 3.1, you'll see that the primary practice area for licensed social workers by 37% is mental health. Social work is big in the mental health area. The next one goes all the way down to 19%, which is children, families, and adolescents. And then if you look down at the primary job function, what are they doing more than like 20 hours a week? 61% of social workers are involved in direct clinical practice. They're right in there working with people directly. That's 61%. The next highest is 20, and that's with administration and management. A lot of social workers begin doing direct service, working with clients, but oftentimes they get promoted to positions of administrative responsibilities. Now, table 3.2 talks about the characteristics of social workers' clients. Who do they work with? So you look and see, what's more than 50% of their caseload. Children, is it adolescents? Is it older adults? Is it adults? Be sure you look at that table and you see, what about race and ethnicity? And client conditions. What are clients coming to see the social workers about? The chapter ends about what social workers earn. Now, it's a profession. You can certainly make a living and be able to pay your bills. You won't be making as much as a nuclear engineer or a surgeon. And that's why, you need to know that this has to be something that is not only a chosen profession, but you also have the heart of the profession as well. There needs to be a good match. And that way, you'll find the greatest satisfaction. But in a sample that was done recently, full-time social workers during the calendar year actually back in 2003. But this is taking into account about 500,000 social workers. The salary was about $50,000. I think it was $51,900. So I guess it was actually close to 52. That's taking everybody into consideration. As a brand new social worker, you wouldn't be making that. If you specialize, then you're going to make more. If you're in private practice, you probably will make even more than that. Social workers can also do teaching, consulting, so you can make a very decent living. You won't be getting rich. If you want to get very, very rich, then you need to look towards a different line of study and work. Well, that's the highlights of this chapter. So we're going to end there.